Hey guys, it is Mrs. Milan again. We're going to finish up chapter 6 today. So we have some objectives for us here. You actually only have two. Draw and describe Maslow's hierarchy of needs. Yes, you do need to be able to draw it and know what it is. So make sure you follow along on the PowerPoint. There is a link to that on the website, of course. And number two is distinguish between culture, race, and religion, and talk about why it's important to recognize a person or a patient or resident's diversity and things that make them different. So as far as basic human needs go, we are not all the same. I hope you realize that. And the people that you're going to take care for are going to be the same. Not everybody that has a broken hip are going to need the same things. Everyone's a little different. Everyone will come to you at different developmental stages. They'll come to you at different ages. So everybody is going to have a different need. But our goal as a healthcare provider is to not only administer physical needs, but emotional needs of the person as well. So back a long time ago, there was this American psychologist, and his name was Abraham Maslow, and he developed this, what he called Maslow's Hierarchy of Needs. So first of all, a need is anything that is essential for a person's physical or mental health. And what he did with this hierarchy is established what the most important were, what were the most needed, and so that's what we're going to be talking about here today. So as you can see on the PowerPoint, this triangle thing, this is this pyramid, Maslow's pyramid, and at the bottom you'll see physiologic needs. Now, I didn't say physical. Make sure there's a difference between the word physical and physiological, so make sure you kind of get that in your head. So at the bottom is physiologic needs. The next kind of step up, if you will, is safety and security needs, then love and belonging, then self-esteem, and up at the very top is self-actualization. This is what I mean, this triangle and these different categories. You need to know physiologics on the bottom, that safety and security on top of that, then love and belonging, then self-esteem, and self-actualization. So make sure you familiarize yourself with that. So let's talk about what each one of these mean. So first of all, with this hierarchy of needs, the things that are on the bottom, according to Maslow, need to be met first. They are a higher priority. They have to be met in order to meet the things that are higher up on that list. So at the very bottom, the physiologic needs are things that are essential to life. Things like oxygen, water, food, shelter, being able to use the bathroom, rest, sleep, physical activity, and believe it or not, sexuality is included in this category as well. So, for instance, if we don't meet a person's need for oxygen within a few minutes, they're going to die. At that point in time, it doesn't really matter if their hair is done, okay? They have a curl in their hair, right? So, the priority at that point is that they need oxygen. So we need to meet that first. So that's what this hierarchy means, that these needs are more important. So some of the things that we can do to help people take care of these needs are helping them with their meals. Maybe they need it cut up so that they can eat it. And sometimes patients aren't going to ask for help. So if you come in and you see a patient hasn't eaten, you might need to offer, is there anything I can do? Do you need me to help you cut your food? The kind of thing. They may need help getting out of bed to go to the bathroom. They may need help walking, and that's what that word ambulating means. You're going to become familiar with that later this year, but that's what that word means. You might need to help them try to provide a relaxing environment to sleep. It is hard to sleep in a hospital. If any of you have ever been hospitalized, you know that nurses coming in and out. So it might be that, if I need to take vital signs, but I know that the lab is coming to take blood at 12, that I try to arrange my schedule to be in there at the same time so that I'm not interrupting the patient, and then a half hour later, the lab person is coming in to take their blood, that kind of thing. Safety and security needs is the next step up. These are physical and emotional needs. So things that will keep the patient safe, make them feel secure. So things like simply washing your hands is going to prevent them from getting an infection. So that's keeping them safe. If somebody's at risk for falling, making sure that, and they use a walker, keeping it close to the bed. If I have a patient who needs a walker and I put their walker on the other side of the room, a lot of times patients are not going to call for you. They're going to try to do it themselves, so they're going to get up and they're going to try to make it over to the walker, and in the process they may fall and end up getting injured. So things like that. Maybe is that we put the call bell in place, that we leave the bed in the lowest position. All those kinds of things that we do to keep a person safe is kind of what we're talking about here. The next category is love and belonging needs. Everybody needs to feel accepted and loved and appreciated. And when you're in the hospital or another healthcare facility, that's no different. So as far as nursing assistants go, some of the things that we can do with that is smiling at our patients, saying a kind word to them, a gentle touch, those kinds of things. Hand on your shoulder, saying good job, that kind of thing. Self-esteem deeds are the next to last category. And self-esteem is, basically how this person is perceiving themselves or how they think other people perceive them. And everybody wants other people to like them and they want to be well thought of, that kind of thing. So, and when you're in the hospital, there's a lot of things that you have to deal with that kind of might lower your self-esteem. Things like having to wear a hospital gown. If you have to have surgery that changes your appearance. Having to depend on somebody for something. If you think of, I know like my grandma, for instance, she was a tough old lady. She, had a knee replacement. She was up and wanting to wash dishes the next day, that kind of thing. So, when you're dealing with somebody like that, you kind of have to approach each person differently. Let them do what they can do for themselves, and so forth. Or like with wearing a hospital gown, maybe you give them another gown to wrap around their back so that their back end isn't hanging out. Maybe it's that you give them a brush so that they can comb their hair, that kind of thing. Providing privacy is a big thing here with self-esteem, helping them with basic grooming, and of course then if they can wear their own clothes, let them wear their own clothes. At the very top of the pyramid is self-actualization, and this is when we actually have our patients reach their full potential, if you will, or their end goal. So if somebody comes in because they've had a stroke, maybe the end goal is that we get them to take a step. If somebody comes in to have a baby, our end goal is that their baby's healthy and they can both go home. If somebody has a broken hip, our end goal is that we can get the person to return their health to the point where they can go home by themselves again. So self-actualization is helping our patients kind of meet those goals that we have set for them in order to help them kind of be able to function at their highest level. So the last kind of thing that we're going to talk about here in this chapter are ways in which people are different. And in some of these topics, you might be like, why are we talking about this? But you're going to be dealing with people that maybe you've never had contact with before, especially here in Fulton County. So, you have to learn to deal with them on a professional level. You may not agree with certain choices that they make, but they're your patients and you have to treat them equally. You can't treat them differently based on their personal choices. So the first kind of category in that is human sexuality and intimacy. So all humans are sexual beings, whether they're teenagers or whether they're 80. Okay, it's hard to think of 80-year-olds in that way, but some things don't go away with age. So your book talks about a couple different kind of classifications, if you will, of individuals as far as sexuality that you may come in contact with when you're dealing with people in the healthcare system. The first are heterosexuals. These are people who are attracted to members of the opposite sex. So men who like women and women who like men. Homosexuals are people who are attracted to members of the same sex. So girls who like girls and boys who like boys. Bisexuals are attracted to members of both sexes. So maybe it's a girl who likes both girls and boys, or vice versa. A transsexual are people who believe that they should be members of the opposite sex. So a person who's born a girl who believes they should be a boy, or a boy who was born a boy and believes they should have been a girl. A transvestite is a person who becomes sexually excited by dressing as a member of the opposite sex. Now, just because they dress as a member of the opposite sex doesn't mean that they're homosexual or bisexual or anyway. In fact, the majority of transvestites are heterosexual men, believe it or not. So as I said, you're asking yourself, why do I have to know this? Okay, so you may never have had to deal with people with these beliefs before, or I'm trying to think of the right word, these choices before, and you may not agree with them, but you do have to take care of them and you have to treat them equally. So just keep those things in mind. Again, you don't have to agree with it, but you do have to care for them the same as you would anybody else, whether you agree with their choice or not. As far as sexuality goes, you do need to avoid being judgmental. So you also can do things to help them feel maybe either feminine or masculine. So for women, it might be let them put on makeup. For males, it might be shaming them, those kinds of things. As little as that may sound, that might help. Maybe putting on aftershave, I don't know. You just let them have their own kind of personal choices and what's right for them. Always knock before you go into a person's room. You don't know what's going to be on the other side of that door. When you're dealing with a nursing home, this is their home. And if you go walking in, you may see more or see something that you didn't want to see. But again, you cannot be judgmental. As I said before, people who live in long-term care can room with their spouse. And if there are spouses living in the same nursing home, who's to say that you might not walk in on something? And I know it's hard to think about, 80-year-olds doing that, but it is possible that you would encounter something like that. Another area where you may have never come in contact with is dealing with people from other cultures or other religions. So let's talk about the difference between the two, as well as what someone's race is. So culture is a set of beliefs, values, and traditions that are customary to a group of people. Now that can be a country, so that could be like American versus Chinese versus Korean, Japanese, that kind of thing. Or it could be in a smaller geographical area like Fulton County. We definitely have our own culture here. Things that we say and we do here are going to be different than what they do in California, okay? So that's what a culture is, just things that are customary to a group of people. Somebody's racial identity is sometimes confused with their culture, but that's not necessarily the case. Race is kind of a general characterization that describes someone's skin color, stature, facial features, and hair texture. So Caucasian, African American, Asian, Hispanic, okay? Especially around here, you're going to hear people say, well, that Mexican, okay? That's putting somebody in a stereotype, and that is not right. That is not what we need to be doing in healthcare. That person is Hispanic because maybe that person was born in Cuba or Puerto Rico or Guatemala. There are different races. So you need to get to know your patients and not make assumptions. Same way with the Asian. A lot of people will classify Asian cultures as Chinese or Japanese, but that's not the case. I mean, there's Chinese, Japanese, Korean, Filipino, like all different kinds of races that you may come in contact with. And each one is different. They're not all the same. And I do have a handout that talks about some general characterizations. If you're interested, I'll be more than happy to share that with you. That talks about some of choices or some maybe preferences that are kind of traditional to that group of people. So for instance, there's certain Asian cultures that they don't drink ice. And so if you are trying to get somebody in that culture to drink, you need to know that they don't like ice. If you bring them ice, they're not going to drink it. But if you bring them room temperature water, they'll drink it. So things like that you might need to take into consideration when you're dealing with patients. Another area that you might not agree with is the choice of religion. Sometimes it can be linked to culture, but not necessarily. And of course, there's all different kind of religions as well and different choices that go along with it. And whatever that person's choice is or that belief is, you don't have to accept it, but you do have to follow their wishes. So for instance, somebody who's a Jehovah's Witness would not be okay with receiving a blood transfusion, even if that meant saving their life. So you might not agree with that. You might think, well, just give them the blood transfusion, but we can't. If that person's choice is to not have that blood transfusion, we can't give it to them. So that's what I mean by you might not agree with, but you have to follow their wishes. And when you work in healthcare long enough, you're going to end up dealing with people from all different cultures, all different religions, all different races. And if you keep an open mind and dealing with people, you can learn a lot, and it could make you better, have a better understanding, and that kind of thing. And what they say, enrich your own life personally and professionally. So take time and talk with your patients, learn from them, and that kind of thing. And just remember that whatever the person's choice, then you need to abide by that choice, whether you agree with it or not. So believe it or not, that finishes up chapter 6 for us. So we are done with chapter 6. Tomorrow we will review. There is a link to the review sheet on your website. If you want to get a head start, you can print that out and get one of those. But other than that, we will review tomorrow for your chapter 6 test. Thanks, guys.